A lot of people are wondering, what is the science that points to restaurants being a prime spreader of the virus?
It's such a good question, Michaela, and thanks so much for asking. You know, the Centers for Disease Control did undertake the most rigorous study that you can do. It's what we call a case control study to try to establish where were the highest risk places, where people were most likely to become infected. And restaurants, whether indoors or outdoors, were deemed one of the places where it's most likely for people to become infected. And that's because the science has been abundantly clear that in places where people are gathering, often with people not in their households, in fairly close contact over a prolonged period of time, without wearing a face covering, there can be high rates of transmission.
Do you think I'm sorry to interrupt, but I think it bears asking, do you think the county does need to do a better job at highlighting that data point? Because I think that when we hear from frustrated business owners, rightly, they're worried about their bottom line. They're worried about their employees who are hanging on by a very thin margin in their homes, paying those bills, meeting rent, meeting the utility bills. Do we need to hear more from your department about that data right there about restaurants?
Yeah, thanks so much. And, you know, again, we always are trying to do our best to get good information out. And I appreciate that it is confusing.
Sure.
And that lots of people are saying lots of different things. And I also really want to acknowledge how difficult and heartbreaking it is for restaurant owners and employees that work at restaurants. These are extraordinarily tough decisions. They really come because primacy for all of us is to make sure that our healthcare system does not become overwhelmed and that we all can get the kind of care that we need. And these sacrifices that we ask people to make are huge. I wish that there was a better safety net. I wish we weren't in the position where we're really saying, you know, choose public health or choose your economic livelihood. In many other places, that's not the choice. Yeah. You know, this is the richest country in the world, and, you know, it's heartbreaking to see that we ask people to make these difficult choices when we really need, you know, economic recovery to go hand in hand with recovering from the pandemic, and that means we need a strong safety net when we have to make hard decisions.